Ignite Healthcare Marketing Podcast. My name is Ashley Petrochenko. I'm the VP of Brand Marketing here at Cardinal. I'm filling in today as host for Alex Monrio. I have a fantastic guest today joining us on Ignite. Please welcome Joseph MacLean, the Director of B2C Marketing at Synergy Health Partners. Joseph, welcome to Ignite.
Thanks a lot, Ashley. I'm thrilled to be on today's episode. I'm a long-time listener.
Awesome. I know Alex always says we have 3 listeners, so now we found one of them. So it's great. So maybe before we dig into the conversation, you could tell people a little bit about your background and the work that you do at Synergy.
Yeah. So at Synergy Health Partners, we're a integrated care model, PE-backed ortho managed service organization, and I lead performance marketing, mostly on the B2C side, but I definitely, make my way over to the referral marketing side and the physician liaison team. This is my first role within healthcare services. I started my career kind of doing social media for New Balance. And that led me to get some e-commerce marketing jobs within the appliance industry, appliance part industry, and then eventually cameras. And I've learned a lot about data and I've learned a lot about conversion rate optimization. Essentially how I think about things are, time of the doctor is inventory to sell. And no, it doesn't come one-to-one, but, I have X amount to sell. How do I drive people that are interested in that to buy? And that's kind of how I break down, the marketing problem and performance marketing projects at Synergy.
I love that viewpoint. I think there's a lot that healthcare can learn from retail. So I'm excited to kind of dig into that. And I think that, the healthcare buying journey can be complicated. It doesn't happen one moment. So how can we as marketers help guide patients through to that final booking and make sure that there's as little friction as possible? So maybe that's something you can kind of speak to. It's like, what have you observed, bringing your retail experience to healthcare? Is where are those friction points happening? Like, what can you do to improve them?
Yeah, I think when I first started, it's kind of baptism by fire because you can't really solve a problem unless you understand like what influences people to take action. And, what I learned actually from when I was doing interviews for this job, I was devouring the Cardinal blog, and there's not really a demand issue in healthcare, I'd say right now. Like, in ortho specifically, the boomer generation is like the target audience. And that's one of the largest, generations in America right now. And so we have kind of, I'm kind of in a good position right now because there's not a scarcity for people who need orthopedic care, but there is a capacity issue. And I think really understanding like, where are those bottlenecks? And you can't really learn anything unless you ask questions. And, I quickly made friends with the scheduling manager, the VP of ops, PAs that had been promoted into, business analyst positions. Or just clinic managers, because you can't learn, okay, who has the biggest opportunity in terms of new patient capacity, who's not filling up their schedule, where are they, and what days of the week. Those are things that required me to really dig into manually on a daily basis. It wasn't necessarily like a silver bullet that I had to like, oh, this person's not here. It's like we had to work together, understand, what's not working, how do we fix it? And, it's problem solving at the end of the day, but it's being willing to ask the question, getting up out of your seat and going and just talking it through to learn how the organization works and who our target audience is and how we can get more, people in the door.
So to understand that like inventory, like the actual physician's like time, is there recommendations that you have? Like one, to get started, it just seems like get the conversation started, just reach out. And then from there, like how are you actually like getting that data now? Have you been kind of building on it? Like it's not a silver bullet, but you have to start building those systems to operationalize the data. Maybe you could speak to what's working at Synergy.
Well, I think, another serendipitous moment is that like people are more used to doing things digitally now. Obviously, people want to connect with someone on the phone, but people don't necessarily want someone to intrude their research process. So if I have pain somewhere, I'm going to go and try to find it out as fast as I can myself. That's kind of the instinct. I think, older generations, they have like, I need to find an expert right now to tell me what's wrong with this. But I think there's this intersection where people are getting more used to looking things up. But in terms of tracking, like there's first party data that you can track, right? In terms of like your EMR or your practice manager. And that stuff reveals, okay, whose schedule is open, how many slots, like, we use the word slot a lot. And so there's new patient slots, there's follow-up slots. And, on a weekly basis, if you're someone who's in charge of driving new patients to the practice, like that's my job, is to drive new patients to the practice. And it's a very intimidating, it's a very high pressure, and it's a very visible role. So if I don't drive new patients, I'm looking at it every week with the C-suite team. They're going to notice and they're going to ask me what's going on. So it's kind of one of those jobs where it's like, okay, I have to kind of forget everything I know and figure out how I can move the needle on this. And, you go to your practice manager and you look at the templates of your providers. So thankfully at my organization, we have around 20 to 25 providers
Hmm.
that are across spine, general orthopedics, sports surgery, joint replacement, hand podiatry, and pain management.
Hmm.
So some of those doctors fall into two of those, but we have 4 spine surgeons, we got 7 orthopedic surgeons, and 4 pain doctors, 4 podiatrists, and 1 hand surgeon specifically. And I can look at their schedules and I know where they are during the week. Either they're in the operating
Hmm.
room at a hospital or an ambulatory surgery center, or they're in the clinic. What I care about is the clinic and
Hmm.
making sure that they have enough time in the clinic. And so I'll go to the practice manager on a daily basis and I'll look at, okay, Dr. So-and-so has 10 slots available on Monday in Livonia. That's where one of our clinics are. And it's like, okay, Livonia is a very cheap place to fill. It's our flagship office. It's been around for 40 years. That's going to
Hmm.
be easy to fill. But the same doctor has 40 openings on Friday in Sterling Heights, which is a more competitive market, harder. I got to really make sure that I'm putting enough spend on my ad campaigns, whether it's social or paid search, to really drive this doctor's presence on Friday
Hmm.
in Livonia that he can fill it. And so that is how I do it. But with 25 doctors doing that every day, it's very time consuming.
Hmm.
And, we're working on ways to make a real time dashboard so that we're able to do these things. But because I'm in charge of the budgets and because we look at these
Hmm.
things weekly, I'm looking at that hourly because I don't want to leave my ads on when there's no capacity because then I'm wasting ad spend.
So it sounds like you're really in the data very closely. You have full visibility into the provider schedule and you're making those adjustments. I mean, is this something like if someone's trying to get started here, maybe they don't have visibility, or like how can other people kind of take the first step towards having a capacity driven like bidding model and like budget control?
Yeah. So honestly, you have ChatGPT, which is a great thing, right? For any resource that you have to learn like a software fast, which is great. Obviously, you don't want to do anything with, customer patient data or
Hmm.
anything like that with HIPAA compliancy. But, if we have NextGen EMR is our
Hmm.
practice manager,
Hmm.
and that has templates for our doctors' schedules. And so within that, I can go all the way back to like last year and look at how people filled out their schedule, the seasonality. So I literally go into the calendar view and it's a grind. It's a thing I think that people don't really realize when they're so wrapped up in their role like I was when I first started. It's literally just discipline. In healthcare, I think the most frustrating thing is it's very hard to clean every data set and integrate it together. Thankfully, I have a lot of experience with my background in e-commerce that
Hmm.
I know how to clean data and integrate it together, but it's still really manual. There's no like easy button that goes and does this. So what I'm looking at is I'm looking at new patient slots. Like, so someone who's
Hmm.
eligible for a new patient, I can count how many of those slots there are, and I can put it
Hmm.
in a spreadsheet on a day of the week, color code it by location for each doctor. And so it's literally like, okay, this doctor's way too full or he doesn't have any opportunity. I can see, okay, well, we don't have a lot of capacity for this service line at this location. I'm able to see that after I do this for 25 doctors by every day of the week. It takes
Hmm.
me roughly like 30 to 45 minutes. I'm pretty fast at it now. But
Hmm.
that gives me my day. And I have a Teams chat that I can go to the scheduling manager and be like, hey, we are very light on ortho
Hmm.
for the next 2 weeks. Can you open up some slots for me? And so what we've learned with cancellation rates, obviously, because
Hmm.
I could have my whole thing filled, but our cancellation rates is anywhere between like 12 to 20%, give or take what time of
Hmm.
year it is. And we'll double book at certain times of the day or give a doctor some PA help
Hmm.
so that they can chart all the new patients or, and the follow-ups and get through the follow-ups faster than the new patients.
So it
So
sounds like just getting
yeah,
into the data, like people just need to roll their sleeves up, get into it, and really just at the very beginning start understanding like what are the trends that people have in terms of the number of appointments, cancellation rates, just really understanding that. And you can start from there as a baseline.
that in PE, I think it kind of is a different thing because if you're at a hospital, doctors kind of have like a set schedule. You can't really ramp up, right?
Hmm.
But at PE, like they want people to fill in the schedules. And so, yeah, I don't want to bore anyone with this, but yeah, it's basically just getting into the data and creating a spreadsheet so you can track things.
I don't think, I mean, it's not boring. I think, well, I mean, getting in there is like the
Bro,
data can be a little bit, but it is such an important part of not wasting your ad budget. Like you can't be sending patients to a booking page where they can't book for 3 months out because what are they going to do at that point? They're going to go to another doctor. They're not going to wait around for 3 months to get an appointment.
especially if they're in pain too. I think that's the thing
Hmm.
is like if someone's not able to pick their kid up, if they're not able to sleep at night, if they're not able to do things like lift their hands up over their head, they want access ASAP. And that's really where we're in the business of is giving people accessibility as soon as possible.
You were mentioning something about your retail experience kind of was like an aha moment here and how you kind of
Yeah.
started to think about capacity. Is that something you could dig into?
Yeah. So at my time at KH Camera, we would have, and this was around pre-COVID and post-COVID, I was there.
Mhm.
And, we had a couple shifts in the marketing team where we have new marketing directors come in and out. My job was basically performance marketing. It was SEO, email marketing, and pay per
Mhm.
click. And so what I loved about that is I could immediately see the results of our initiatives. I look back at a specific moment where a new director was on and was like, hey, what can we do to improve performance?
Mhm.
And, I knew that we had, a couple of competitors in the area that sold a camera for like almost $100 cheaper than us. And we were still sending traffic from Google Ads, to this page, and it had the worst conversion rate. And so I was, my thing is like in margin is a huge game in retail, right? It's like, okay,
Mhm.
margin relates to how fast can you sell it? What can we get back for it at, what pace are we okay with selling this item based on the margin? And so we basically were getting undercut. It was an older model called the Nikon D750, and we had about 100 of them in stock, and that's like way more than we're used to. And it was
Mhm.
just basically diving into the data to see, okay, our offering is not competitive to what the market is right now. And it is as simple as that, is just being able to see like, okay, we're wasting ad money and we're holding on to more inventory for longer, which in retail is just a terrible recipe. So healthcare is even higher stakes because
Mhm.
you at least have items you can sell that are not going to go away, right? Time goes away. And so if
Mhm.
you aren't taking action today to fill time, it's going to go by and you're going to lose your opportunity to get the results that you need to maintain the performance of the organization. So especially, I'd say this month and last month, November and December in healthcare are funny months. They're
Mhm.
compressed because you have the end of the month, you have holidays where doctors are on PTO, patients have kind of funny behavior. And so you really have to do all your performance within those first 3 weeks. And those products on the retail shelf, they're always going to stay there. Obviously, you want to have certain performance, but it's a lot easier in retail, I'll say.
Yeah, if you're not using your full utilization of your doctors, I mean, it's gone and you won't get that revenue back, that opportunity. So, are there things that you're doing to try to move patients to that booking? Like, are there moments when they're still in that research phase? Maybe they're not quite ready to reach out. Like, how are you kind of approaching that to kind of like move them, building that funnel to book an appointment?
Yeah, it's funny. It's funny. The other thing that's difficult about healthcare is that you can't really do re-engagement campaigns, right? With
Mhm.
HIPAA laws, you can't really define a person that's visiting your site because of the personal healthcare data and how it's defined by CMS. But yeah, there's like directional things, and I think I harp on this. Like I was not a statistics student in school, but I understood that you have ChatGPT today that really can help you learn, either Gemini, whatever. There's
Mhm.
guided learning where you can understand like regression analysis. And
Mhm.
so, I think you guys harp on it too with your medium mix modeling, like where you
Mhm.
basically try to understand, okay, we did this initiative, what was the overall impact of it? And nothing I'm going to say is like scientific like that, but basically I understand that the research people do is like it's like 1 to 2 weeks. So if we spend money, we're going to
Mhm.
see it in 1 to 2 weeks. And people, depending on their pain, they'll pull the trigger within the day if they can get in. If they go and get referred to another clinic, they're going to come to you. So it varies. But I would say that what we're doing is we do tag our site with our analytics tool, and we're able to see certain actions, and we can put people into cohorts based on when they visited the site and when
Mhm.
they came back. But it's not something that we're overly like. I'm not doing that every day as much as I am like the schedules, but
Mhm.
I'm able to understand. Okay, we had this many clicks. Our conversions that we track on our website are okay, how many phone calls lasted over 2 minutes? How many new patient clicks do we get on our website? And, I essentially see those as leads. And I'm able to see when those people do book appointments. And it's sometimes it's the same day, but the
Mhm.
majority of them are people who've been in the buffer for about 1 to 2 weeks that, are doing research on other doctors' availability, the
Mhm.
reviews of the doctors, and then they come in and they basically make a decision like I need to take care of this, and they book their appointment. So those are things that you have to really look at. And I think sometimes people can get caught up in like, how do I tag my site on based on events? I would just look up how to do it. And, it's not something that you have to rely on
Mhm.
someone else to do. It's not difficult. It's just something you have to learn. So that's what I'd say.
Looking at the path that people are taking over that 1 to 2 week period, you mentioned reviews and like understanding, is this a doctor for me? Like, what are you doing to try to like build that trust and presence that, is going to make someone choose Synergy?
Yeah. So if I started my role in it, there's so many things I would love to have known. And
Mhm.
really the reputation management system and software and how are
Mhm.
we getting those reviews is something I had to learn. I try to follow best practices with the tool that we had, and it didn't really do what I wanted. And one of the doctors was like, "Hey, a lot of our competitors are getting way more reviews, and I'm friendly with them, and they don't have nearly the busy schedule I have. Can we get more of these things?" I'm glad the doctor came to me in that situation and asked me that. I didn't really have an answer for him at the moment, but I did
Mhm.
some research, and there's a tool called Raider 8. I don't know if you've
Mhm.
had people come on here and talk about it before, but you guys have great people come on and talk about tools all the time. And Raider 8
Mhm.
was one that was like specifically for like the price point they had was for each individual doctor. And the strength they had is that they got more volume of reviews because they sent out the review request within like 3 hours of the appointment,
Mhm.
where ours was set at 3 days and there wasn't much we could do to change it. And so,
Yeah.
yeah, so 3 days,
People are forgetting.
yeah, exactly. And but from that, it was like double the reviews in the month. And those are things where they're leaving comments. I'm able to see the sentiment of the review. But then
Mhm.
also we're going to like, people who are getting surgeries and having great surgeries. We get, we're a part of some associations where those patients take surveys. It's called Code and I think MISIC, and it's related to the state of Michigan. But it basically just looks at the outcome data of the surgery. Was the pain better than what the patient expected? How likely would they refer it to a friend? And were they
Mhm.
overall satisfied? And a lot of detailed sentiment research on that. But that's a project in 2026 where I'm taking that data, putting some marketing flavor on it, being vague in ways that like I can be vague, but also expressing the positive sentiment, not in an ethical way, and
Mhm.
putting those on the profile page of the doctor so that if someone's researching it, they can see the reviews, and they can
Mhm.
also see the outcome data. Because if I'm buying a product or I'm picking someone based on something, I want to see that. And I think that's really what comes today. It's like, yeah, there's an accessibility strategy where visibility and
Yeah.
accessibility, there's going to be growth there. But if you really want to go to the next level, it's distinguishing your doctor amongst the competitive marketplace that you're in and how they're better than the others or what makes them different and it could be good for you based on
Yeah.
your what you're seeking as a patient.
The consumerization of like healthcare. I mean, people are used to going to Amazon, they're used to going to the internet and reading those reviews and seeing the outcomes like, did this product work? And is my knee replacement going to work? Am I going to feel good after this? And they want that
Yeah.
same kind of assurance so that they can feel confident in the decision that they make.
A product detail page, right?
Yeah.
That's a doctor's page.
Yeah.
It's like the same thing. It's like, reviews, product specifications, like all of those things. I go to those, like I go to Amazon, Nike,
Mhm.
Apple, and I look at how they organize information and design it in the page so that we can, there is some sort of correlation, that we can do on our doctor pages.
Yeah, it's like kind of like jump like a heading. Like they have done so much UX testing, so much user research to understand how people are making decisions, what information. So like healthcare can kind of skip ahead and learn a lot from just studying those pages.
Yeah. Don't reinvent the
Mhm.
wheel, right?
Yeah, yeah, definitely. Is that something that you're investing more into video? Or is it most of your testimonials now like written? Is that something you're going to explore more of like video content next year?
Yeah, so we are definitely investing a
Mhm.
lot in video next year. For example, like our spine surgeon, we hired basically two brand new spine surgeons. One of them is brand new to the location that we're at.
Mhm.
And in my mind, building up a new surgeon or, a new doctor in a new location right out of fellowship, that is one of the most difficult things in the industry because you need to fill them up fast to get back to where you were or if you want to grow. So I think that, you need to have a game plan in terms of okay, how do I capture really satisfied patients? Like it's almost like any sort of brand 101 or, you have like your customers, repeat customers, and then like your brand advocate. And, it's basically finding the brand advocate in your reviews and then reaching
Mhm.
out to them personally and being like, hey, we were really excited that you had this. And I asked the doctors to give these to me. And, the doctors are more than excited to find these patients because the doctors are kind of mini celebrities in terms of like
Yeah.
how people interact with them. And if they, are going to be hand chosen to kind of represent what the doctor did for them, it's easy to do. But I think having the system to set up, like it's one thing to just have an iPhone and, say, how did you do? But there's HIPAA compliance that you have to get over. So
Mhm.
it's really, systematizing it in a
Mhm.
way, but you have to kind of organize all the information up front so that it really can be a well-oiled machine to get the results you need.
Are you hiring like a whole like video team? Or are you being scrappy, doing a lot of it in-house? Is it kind of like we have a mix of listeners who are like, they have the big budgets, and others, even if they're getting squeezed a little bit, but then others are like, I'm one person or like that team of three. And how scrappy can you get to kind of get some of the content that you need here?
Yeah, I think there's two different fronts, right? And I've been in both worlds. I learned how to use cameras from being at KEH, that company I was at. That was a skill set that's really, helped me do a lot of things in my personal life, but also get scrappy. Like in terms of all our headshots, I take all of our headshots in the office at our place, and that's one way to do it. But I would say that go to the OR, go to the clinic, and email is a powerful tool. I know as a millennial, I like Teams, I like text messaging. But like to really plan something out, you need to align and find your allies, because everyone wants to grow. And so if you need to be scrappy, you need to write a script, you need to, schedule time, and you need to ask the doctor. So like we've done some of those, we can, but I think more for the social video, the more authentic, the better. The handheld phone shot is a lot better for engagement on social platforms. You want it to be approachable. So I think no matter what situation you're in, it does just take rolling up your sleeves. And I think the video, it goes a long way in terms of it's, they say picture's worth 1,000 words, like a video is worth, a billion words, right?
Yeah.
So
Yeah, people definitely want that like user generated-esque like element, like this shiny, full produced video sometimes they don't feel like trustworthy always. People want to like, oh, this is my neighbor telling me the experience they went through. And that in a lot of ways I can feel more personable and relatable, but like you were mentioning. So I think just getting started is the best thing.
You look at anyone who's started doing video stuff, look at their first video they posted. It's never the best, compared to where they're at. So, habit and discipline are powerful tools in this.
So taking a look ahead at 2026, what is your biggest priority and like where are you focusing for next year?
Well, our spine service line. So in our integrated care model, ortho and spine are the most profitable service lines. And so we want to really ramp up our spine service line. We have 2 new providers, and we've never had the volume of capacity that we've had here. So, we want to basically 120% increase our performance over 2025. And so, building an engine to do that is going to be a big deal. And, I think the demand capture is one thing, and demand generation is another thing, right? So I think we're going to go into more of the demand generation side to drive, patients to our spine doctors. So that's the goal there.
What's your channel mix look like? Are you focusing on like the top of the funnel, Instagram, like Facebook type of to generate that demand?
Yeah. So our channel diversification is we have a PL team, physician referrals. And I think a lot of the things too is that we really want to give them more tools. So, we have, obviously you collect primary care doctor and referral doctors, right? But like the primary care doctor didn't refer them sometimes. And so if there's a primary care doctor that's not currently referring our patients, we want to make sure that we go out and get them, especially ones that are spine patients, because the demo of that person's practice, that's a great one that we can dip into and create a relationship. So there's definitely ways that we want to make sure that we do it within the PL, physician liaison, and referring marketing. But in terms of just people searching, Meta is obviously one that we really want to go into, because you can target without targeting any sort of health data based on their demographic, where they live, what age they are, what gender they are, and it'd be able to say like middle-aged women are our best audience, right? So we want to go and target that, but I think the content strategy around that has to be like, what are people engaging in that, and what are the common conditions that they have, and put a doctor and speak to them in a relevant way, right? Like it's like it could be around like what shoes are good for you, something that's an entry point. And so that's what we're really focusing on, is just creating content that's relevant, not necessarily content that's relevant to our business goals. It has to be that Venn diagram where we're going to test and learn, and we like to adapt fast to what works.
And you're starting with the patient first. Like, what are the problems that they have? And if you can answer that and get them to engage with your Facebook content, your Meta content, whatever, then you're building that funnel of engagement, and then you can bring them closer and closer to actually achieve the goals of the same business goals that you have. I loved what you said. You're also working with referral liaison teams too. So this growth engine isn't just, for the performance marketing side. You really need to have that strong alignment with the operational team to get information and understand the capacity and where the growth objectives are. But then also you're working as one of those channels with the referral team.
Yeah. So we have like a team of 4 call them physician liaisons, where they go and they book lunches. And in Michigan too, like we have unique automotive laws where like if you get in a car accident, your auto insurance has to pay for the medical bills. So, those ones pay like, I think it's a, higher rate than Medicare. So those are like, we call them premium patient segments because they're patients that need care, and the reimbursement model is way better than, what Medicare provides. So, we're trying to, partner up with personal injury lawyers to understand like,
Mm-hmm.
hey, how can we help your patients get care faster? And there's not a lot of orthopedic practices in Michigan that take on
Mm-hmm.
auto insurance because it's a slow cash flow cycle. That's one that we're doing, but self-pay is a huge thing. I know there's been a lot of things in the media about,
Mm-hmm.
insurance premiums, high deductibles. We want to make sure that we're offering self-pay so that people who like have a wrist fracture, if they don't want to pay $12,000, that we can offer a cash pay service that's cheaper than the hospital and makes more sense than doing, using their insurance that has a high deductible to it. And then, yeah, the referral marketing is a big piece. Like, I
Mm-hmm.
think there's, we're wanting to build within our software the ability for a doctor who referred a patient to speak to our doctor so that we can build that relationship up, because there's
Mm-hmm.
no better way to build trust with an external practice than being able to report on a patient they sent us and knowing that they're going to get great care and get taken care of.
I love it. The trust goes in every direction. The patients need the trust, but the referring doctor needs that trust too.
Absolutely.
Awesome. I love it. This has been a great conversation, Joseph. I really appreciate the time, sharing a little bit about what you have going on for next year. If anyone wanted to reach out to you with questions and to learn or to connect, where could they find you?
You can find me on LinkedIn, or my email address is joseph.mclean@icloud.com. But yeah, LinkedIn's probably the best easy way to find me, Joseph MacLean.
Great. Well, thanks for joining us, and everyone take care. Thanks.
Thanks.